Welcome to the Home Health Patient Tracking System for the OASIS-c form. We'll be reviewing some of the features of this online system, and we're going to go through it fairly quickly. The beautiful thing about online video is you can pause it as you wish. First, there is no charge for the online OASIS-c system. This system was funded to assist home health care agencies with the OASIS form. We all know the problem with the OASIS-c form. It's 24 pages long, with over 470 data points. But to make it harder, there are 6 OASIS M-code paths on the OASIS-c form. The data required for these 6 separate paths are spread across the 24 pages. Then, each OASIS form path should be reviewed, edited if necessary, prior to submission and then billing. Paper files. Who wants to print and file this paperwork? Many offices print, complete, file, and then forget the past forms. Retrieving old paper OASIS forms, reviewing, and printing is incredibly inefficient. If the OASIS home health care provider snail mail the OASIS forms, the time and postage are wasted. And then there are other considerations for every office. You have employee time clocks and accounting, reports, and there are dozens of other additional home health care forms. These options are scheduled to be added. The forms are brilliantly designed and licensed from a research organization dedicated to serving and improving healthcare for geriatric and disabled populations globally. This organization is a not-for-profit corporation, but there is a licensing fee and agreement for this group. When we make these forms available, you have the option to add them for a monthly fee, but you will not be required to add them. If you're familiar with the OASIS form, you recognize the first page. But on the third page is where the real fun is, following the specific time points by M-codes. These time point paths are the start of care, resumption of care, follow-up, transfer to an inpatient facility, discharge from agency by death at home, or discharge from an agency. And as you look at the M-code paths in the center, you'll see that the data is cherry-picked from across the 24 pages. So this system has the data sliced and organized from the OASIS form. Obviously, we allow you to enter the data with streams sufficiently organized by what we call time point paths. Let's make the OASIS form easy, but first some technical details. This system is all HTML5 and all work is server-side, so there are no plugins required. It is compatible with desktop computer browsers, Android, and Apple iOS smartphones and tablets. All your data is completely secure with SSL encryption. This is a cloud-based application, so the data will be equally available across the United States. And the database is Safe Harbor compliant, as required by the U.S. Department of Commerce and the European Union. This system is only available to verified home health care agencies. Each agency can create an unlimited number of employee logins for branch managers, nurses, doctors, and patients. Each agency can create and track an unlimited number of patients and OASIS-c forms for each patient. There is efficient OASIS-c data entry on desktops and tablets, secure internal note system for data correction, online appointment calendar, OASIS form review and printing, Google Maps for patient location, and a GPS time clock check-in and check-out at the patient location. And again, all this is provided for free. From our front web page, you'll see a button to sign in. Click it to go to this page. Here you will pick the branch login name, password, and email address. Of course, the login name and the email address must not already exist. A representative will contact your office to confirm that this is a valid home health care agency. This is required by our agreements with other companies, and your user login will be activated. Now let's look at the system. There are 5 different dashboards for user types, such as doctor, nurse, manager, and branch. We'll look at the dashboard for the branch because this has every option available. The manager has all the same options except the ability to modify the branch, which is the office information. Here's a quick review of some of the buttons. Then we'll look at some buttons in more detail in a few minutes. First, schedule a new visit. Visit notes, people lookup of staff and patients, a calendar of visits. From dashboards, you have an online support. This allows you to have live online chat, or if support is not available, you're given a window to email a support person. After a visit is scheduled, you click on the button to enter the OASIS form information. Online help is mainly online videos. From the dashboard, you can click on the patient name, the nurse's name, or the manager name to move to a visit screen and view that person's schedule and work. Now the Maps and Route feature is pretty interesting. This allows the caregiver to check in and check out of a GPS location with the time and date. We'll see that in a few minutes. And here's the name of the form that will be completed on the visit, such as resumption of care, start of care, transfer. The log out button is at the top, and if there's no activity for 90 minutes, you'll have to log in again. You display different types of visit records by their status, needing review, edits, or they're closed. There'll be more on that in the help videos online. Future options for billing, reporting, time clock functions, and data analysis are scheduled to be entered. You can edit the form status here and view the form status here. Click the dashboard node icon and you have a notes window overlay. The window starts with emails from everybody that are unread, but you can toggle to look at only your notes and or all notes if they're read or not. If you want to look at a note for a specific user, you have to go to that user's view. You can jump to the complete note as part of the notes are only shown in this window. And you can jump to the visit record to view all the notes connected to the form and the form itself. Or on the dashboard, you can click the calendar icon and a calendar overlay will appear. When you click on an appointment, this will take you to the visit date. So from the dashboard, let's click on Nurse Randall's name. And we're shown a view of Nurse Randall's information. You see all of her visits and their status. To look up notes to and from that user, click on the notes icon. To review the calendar, click on the calendar icon. And now for one of my favorite tools, the Google Maps route check-in and check-out. On the left is the computer location, determined by the internet connection. On the right is the mapped address for the patient. And if you click the route button, we display the road map to get you from your location to the patient's location. The time clock feature allows you to click the check-in button. This records the user's location, time, and date. Then when the health provider leaves the location, they click the check-out button. This is ideal for users using internet-enabled tablets or phones on the road. We like this feature so much we are considering making it a free standalone tool in the future. A quick review of efficient OASIS data form entry. A touch-friendly screen is brought up in a window for the OASIS form path. This screen works well on desktops, computers, tablets, and smartphones. Here we're showing the resumption of care. Touching a gray section opens up the questions for that part of the OASIS time path. A floating save button is always available on the data entry screen so you can save your work and go back to it later. And here's an example of the form automatically resized for a smartphone. So let's look at the form management features and data entry tricks. If we click on the visit date, we see the visit form. Health sections from the OASIS form are displayed by clicking here. Time point groups on the OASIS form are displayed by clicking here. Notes are always available and only attached to a visit record. So looking at the form sections, if we click on it, you'll recognize the different sections in the OASIS form, such as cardiac status, elimination status, living arrangements. If you click the OASIS assessment information set, you'll see the specific M-code data pieces that are needed. The M sections are required for the resumption of care. The green color shows that the data has been entered. Now just to orient you to the Form M data, this screen shows the complete OASIS form. This is very inefficient, but it helps you see all the data for the OASIS-c time points. But for data entry, this would be the start of care. And here's the discharge from agency death at home example. It has the floating save button on the right. We don't need sections for this form because it has so little data. Specific video tutorials are always available on the screen throughout the system. These include flagging forms for edit, review, and approval, entering and reviewing patient notes, printing OASIS forms, which is easy, time point subsections on the OASIS form, the Google Maps and GPS confirmed check-in and check-out, and future features for other forms, reports, and analysis. If you have forms you would like us to consider adding to the system, we welcome you to email them to us. Every section helps make the system better for everybody. And we do not ask for any credit cards or any hidden charges. Use of the OASIS system is free. Well, this completes the system overview. We hope you have found it useful. If you have any questions, email us. We'll email you back, give us your phone number, we might call you back. If you're a home health care provider, we welcome you to sign up and start benefiting from the system today. Thank you for your time and have a great day.